Thank you everyone for joining us with this community health education webinar. My name is Myrna Jarami, and I'm a field marketing specialist for Axonics Therapy who will be moderating this educational talk. Dr. Salva will be speaking about stress urinary incontinence, the common symptoms patients experience, and treatment options that you may need in order to help you regain bladder control. Without further ado, I'd like to introduce Dr. Salva.
Hello, my name is Steven Salva. I'm a urologist for MidLantic Urology. This conversation today is in no way a paid advertisement. I have been doing this procedure for a number of years, and I'm speaking from my expertise in this topic. Urinary bladder and bowel symptoms can disrupt your life. Sometimes people drink less fluids in order to do daily activities. Sometimes they even miss their daily activities in general, just from the incontinence they have. And they worry about where their nearest bathroom may be. But you are not alone. This is a common problem. It is estimated that upwards of 50 million people in the United States alone suffer from some form of overactive bladder or incontinence. So today we're going to talk about how we can understand this condition a little better. Urinary symptoms may be caused by overactive bladder, which is when the bladder has a sudden urge to urinate and you're unable to control that urge. Sometimes it's urinary retention, which is the difficulty in holding onto the urine, or urinary retention, which is difficulty urinating and the inability to empty the bladder. And there's also fecal incontinence, which is the involuntary loss of stool. The normal bladder functions by filling, storing, and emptying when it is convenient for us. And this is mediated by the fluids we take in, but is also controlled by nerve signals sent by the brain. And these signals travel between the brain and the bladder and back and forth. Overactive bladder is frequent and urgent need to empty our bladders. It can present with a number of different urinary symptoms of frequency, urgency, urinary incontinence, which is the loss of urine involuntarily, or nocturia. Nocturia is defined as waking up 2 or more times per night in order to empty your bladder. Overactive bladder is often caused by what we think is abnormal communication between the brain and the bladder. And this leads to those feelings of overactive bladder, of frequency, urgency, or incontinence. This interferes with daily activities. We may need to rush to the bathroom sooner than we need. We may actually be wearing protection such as Depends or pads more than we want to. There are multiple types of urinary incontinence, including stress urinary incontinence. There's urge incontinence, and then a combination of stress and urge incontinence called mixed urinary incontinence. Urinary and fecal incontinence interfere with multiple quality of life issues. We may be limited in our physical activities, or it may restrict us from certain physical activities. It reduces our ability to be social and may change travel plans. And psychologically, it has a big effect with fear of accidents and loss of self-respect. The incontinence can also affect us sexually and in multiple different ways. The condition is not something that you did. It is not part of just getting older as a woman or an issue of a man with a prostate. It is fixable. There are multiple treatment options. Usually these treatment options start with a consultation with a urologist. And at that time, we will take and discuss your urinary symptoms. We will look at your urine, look at your post-void residuals. Then we initiate a treatment plan. These treatment plans generally start with behavioral changes. They may include dietary changes, and many times will involve prescription medications. We then will follow up with you and see how these initial treatments work. If these initial treatments do not work, do not give up hope. There are advanced therapies, and we're going to talk about that today. The treatment for overactive bladder may involve behavioral changes such as bladder training schedules, timed or delayed voiding, or even pelvic floor exercises or biofeedback. But sometimes we also include lifestyle changes, such as monitoring your fluid intake, avoiding certain beverages, or changing your diet in some way. If those modifications do not work, we then proceed with prescription medications. The most modern medications we use right now are beta-3 adrenergic agonists, beta-3 agonists. These promote bladder relaxation and allow the bladder to store. Older medications include anticholinergics. Unfortunately, anticholinergics have been shown over the years to have multiple side effects, and especially in an aging population may cause more problems. Because behavioral modifications, dietary changes, and medications are not always effective, we then proceed with third-line treatments for overactive bladder. And this includes percutaneous tibial nerve stimulation. And this is an in-office treatment that takes 30 minutes per treatment session over a 12-week period. We generally see responses within 1 to 2 months. And then if successful, we continue with the treatments every month thereafter. There are also treatments including chemodenervation of the bladder. This is done with botulinum toxin. Botox is injected into the bladder wall as an in-office procedure with local anesthetic period. We will inject the Botox on average every 6 months. And there is sacral neuromodulation therapy. And this uses stimulation to stimulate the third sacral nerve. And the third sacral nerve is very important because off the third sacral nerve goes a nerve to the bladder. And by stimulating this nerve, we are able to help control bladder overactivity. Axonics therapy is a form of sacral neuromodulation that controls both bladder and bowel overactivity. How does axonics work? It is a gentle stimulation of the third sacral nerve that can help restore communication between the brain, the bladder, and the bowel, and it results in an improvement in urinary and bowel symptoms. The first step towards axonics therapy is an external trial system, and this is done one of 2 ways. We either do this in office as a pelvic nerve evaluation, and this is a 20 to 30-minute procedure that we do with local anesthetic. You typically will go home with an external device for a few days. And there's a second way we could do this in the operating room, and it is called a stage 1 lead placement. We are allowed to leave the lead in place a little longer with a stage 1, and sometimes this is a better way to test the bladder or bowel depending on your presenting symptoms. There are 2 forms of batteries that axonics presents. One is a rechargeable device that is rechargeable for approximately 15 years. It typically takes about an hour to recharge this device on a monthly basis. And there's a second type of battery that is a non-rechargeable device that lasts anywhere between 10 to 20 years. Both batteries are quite small. The rechargeable battery is smaller than the non-rechargeable battery. Both batteries are fully compatible with MRI scans and are approved in both 1.5 Tesla and 3 Tesla MRI full body scans. The Axonics pelvic neuromodulator is controlled with a patient remote control. This is a pocket-sized and easily managed device. It is discreet, and you can adjust your therapy as needed with this device. The charging system for the rechargeable battery is performed approximately once a month and usually takes less than 1 hour. Almost all patients found charging easy, acceptable. And in some situations, people wanted to charge more frequently than once a month. If you charge more than once a month, the charging time is sped up. Axonics pelvic neuromodulation has meaningful and lasting improvements with clinical significant improvement in incontinence symptoms of approximately 93% at 2 years. At 2 years after implantation, over 90% of patients were satisfied with the results. So ask yourself, do I struggle with bladder leaks when I sneeze, exercise, laugh, cough, walk? Then you may be suffering from stress urinary incontinence. Stress urinary incontinence occurs when there's an increase in abdominal pressure through any type of cough or sneeze, laugh, or exercise. This increased abdominal pressure pushes the bladder against the urethra. Typically, the muscles around the urethra will contact and keep the urethra closed. Unfortunately, in stress urinary incontinence, the muscles around the urethra may be weakened, and that will allow urine to leak with the increased abdominal pressure. Stress urinary incontinence is very common and may affect upwards of 1 in 3 women at some point in their lives. Of these women, 60% will say that their symptoms of stress urinary incontinence meaningfully impact their lifestyle. Stress urinary incontinence is treated through multiple different treatments, including pelvic floor exercises. There is also a surgical sling that involves an implantation of mesh, and there are also urethral bulking agents. Stress urinary incontinence can be affected by lifestyle changes such as weight loss or gain, smoking, chronic cough, and can be improved through multiple different forms of exercise, including pelvic floor exercises such as Kegel exercises, and work with a physical therapist. Stress urinary incontinence is also treated through a surgical implantation of a mesh material. This mesh material has shown 80 to 90% success with a 17-year follow-up and is still considered the gold standard for surgical management of stress urinary incontinence. There are also urethral bulking agents. In this situation, a bulking agent is injected into the walls of the urethra and is done as an outpatient procedure. The bulking agent does not involve the placement of a mesh. And because there is no mesh involved, it is low risk and allows you to continue to be active after the procedure. Bulkamid is a minimally invasive, non-mesh alternative to treat stress urinary incontinence. Bulkamid is made of a soft, water-based gel that is clinically proven to improve stress urinary incontinence.
Bulkamid can help provide the relief you've been longing for. The short, incision-free procedure typically takes less than 10 minutes. Involves 3 to 4 small injections of soft, water-based gel into the wall of the urethra to help prevent urine from leaking out of the bladder during day-to-day activities. It's safe, quick, and most patients can get back to your normal activities almost immediately.
Bulkamid is implanted via a syringe into the urethra, and it helps close the natural mechanism of the urethral sphincter. It is similar to a facial filler, and it remains in the body over time without causing adverse reaction to the surrounding tissues. Bulkamid is safe and effective. It is effective in upwards of 92% of women. It is a simple procedure that involves approximately 4 small injections. These 4 small injections typically take around 10 minutes to do, and there is long-lasting relief that is shown to work upwards of 7 years.
Thank you, Dr. Salva, for sharing your expertise. If anyone is having any questions, they could always reach out to you. So we have the slide here so that they can definitely reach out, schedule an appointment, or, call for a consultation. The other part I wanted to really make sure we do is, because we get a lot of questions based off of the feedback we've received from a lot of the practitioners who treat patients with this therapy. We have several questions that I'm going to ask you so that you can provide some insight as well. So the first questions are going to be about Axonics. First question is, will walking or running for exercise damage the device?
Exercise does not damage the device. Once we implant this device, it is safe to resume all physical activities.
Okay, the next question is, will the implant set off a metal detector?
The implant will set off metal detectors, and it is important to let any screening agent know that you have a medical device. We will also provide you with information card to give to that agent, and prior to any screening with a machine or handheld device, you will inform that you have a titanium implant that could set off the device.
Could there be any interaction between implants between two people? For example, a patient's spouse that has a pacemaker?
No, there is no interaction between two different people who have different devices. We do take caution sometimes when a person already has a device such as a pacemaker, and we make sure that we measure enough distance between the Axonics device and an already established device in your body.
How long does recharging take?
Recharging depends on how often you want to recharge. Most people will recharge every 4 weeks, and it will take less than 1 hour. If you decide to recharge more frequently, that recharging time will be reduced.
Okay, so now for the Bulkamid questions that we have. What are the activity restrictions or guidelines for this type of therapy?
For the first 24 hours, we refrain from any physical activity. After 24 hours, you are free to resume all physical activities.
After the Bulkamid procedure, when can a patient be treated with Botox?
After Bulkamid, we usually recommend 3 months to allow the Bulkamid to heal and cause appropriate fibroblast growth into that tissue. After 3 months, somebody may go through Botox injections if they want.
Can patients get pregnant or have a normal vaginal delivery with Bulkamid?
Absolutely. Bulkamid does not interfere with vaginal delivery or pregnancy.
And the last question we have here is, can Bulkamid be used by men or in men?
Absolutely. Bulkamid has not been approved formally in men. There are long-term studies being performed right now with the long-term efficacy of Bulkamid in men. It has been approved in women, and we have used Bulkamid in men, but again, this is what is considered an off-labeled use, which means that we will have a discussion about the possible ways to treat men with Bulkamid who have stress incontinence.
Fantastic. Thank you so much again, Dr. Salva. This brings us to the end of our community health education webinar. Again, if you have any questions, please contact his office and schedule a consultation or make an appointment. We hope that you found this presentation very beneficial. Thank you.
Thank you.